right. So I'm Stefanie Vandevijvere. So I'm joining today in my capacity as part of the leadership team of the INFORMAS network. So to give you an introduction on the Healthy Food Environment Policy Index, which has already a history as it has been applied in quite a few countries worldwide. And so some of you in the audience will already know the ins and outs of the tool and the process and will have applied it in their own country as well. And so happy for you as well to jump in or to share experiences afterwards. So this session is really meant for researchers who are interested maybe to conduct this process in their own countries and to know a bit more about how it's been used already, which countries have implemented it, what are some of the benefits, and also um, what's involved. So in order to be able to conduct the process. So that's a short overview. Normally, we do conduct training sessions as part of projects, so they may take up 1 or 2 days in practice, so as part of workshops. So online, of course, is a bit of a challenge. So in this case, it will be more like an introduction and then some possibility for questions afterwards. But there's always opportunity to contact us later on if you are really interested and want to get access to the protocols or some of the tools that have been developed as part of this. So it's all open to everyone who's interested. So hopefully, yeah, you can learn a bit more today about what's involved, and in case interested, uh, yeah, we can look for other ways to get more in depth later on and so on. So first, I'm going to really give a broader overview of the tool and the process so that you understand what it is about, and also a bit on which countries used it to date. And then I'm going to go a bit more into details about the tool specifically and its indicators, and then also the process and the different steps involved. And then if there's still a bit of time, we can look also a little bit at the future and what's planned in terms of future development for this tool. So the Food-EPI is actually part of INFORMAS. INFORMAS was founded in 2013 as a network and a framework to monitor and benchmark food environments, so all aspects of food environments, because the idea was that there is not a lot of data available globally, and no countries are really comprehensively monitoring food environments. And as we know, if there's no data, no monitoring, then usually it's hard to get any actions happening as well. So it's really a monitoring initiative that has started in 2013. And so food environments are really the physical, economic, policy, and sociocultural surroundings, opportunities, and conditions that really determine people's food preferences and habits and so on. And we do know that food environments are quite important in terms of a determinant of diets, and malnutrition in all its forms is also really the number one preventable contributor to the burden of disease globally. So this is really the INFORMAS framework summarized. We are not going to go into the details today. So it does have several modules looking at, so the process modules on top, they really aim to evaluate the key actors, so governments as well as the food industry, in terms of their actions to improve food environments and nutrition. And so today we are going to focus on the public sector module, which includes the Food-EPI. But then there is a whole series of modules that has been developed to monitor several aspects of food environments, and there's indicators and protocols for those as well. And several countries in Africa are already using some of those in their own projects. For example, looking at marketing to children or the retail food environment and so on. So the whole idea of INFORMAS and to do this monitoring and benchmarking is ultimately to increase accountability of actors. So really the data that is collected aims to contribute to taking the account, sharing the account, holding the account, and responding to the account. So all steps of the accountability cycle. And ultimately, where there's sufficient data available, INFORMAS does conduct multi-country studies comparing countries on several aspects of the food environment. So this is just an example on marketing on television, a common protocol that was used and that is looking at the rate of non-permitted food advertising targeted to children on television across several countries. And then similarly, of course, we can also look at how different companies contribute to unhealthy food advertising as well across countries. So that's just an example. There are other examples, but it depends on the modules and how many countries have data available for those. But in any case, so INFORMAS is really an open network. So the idea is that researchers can join whenever they feel it would be useful. And so the protocols and materials are also available upon request. And there are also regional teleconferences several times a year meant as really informal networking. And so for each region, there is one such an event. And so the European African region is usually combined because of the time zones. And so, of course, there's always options to join some of these meetings as well. So then we come to the Food-EPI, the Healthy Food Environment Policy Index. So what's the aim of such an index? So broadly speaking, it's really to evaluate the extent of implementation of policies, but also infrastructure support to develop and implement policy for creating healthy food environments by governments compared to international best practice. So it's not just looking at whether certain policies are implemented, yes or no. It's really looking at the whole policy cycle from development and design, implementation to evaluation as well. And the evaluation is done compared to best practice, which means compared to policies and actions that have already been implemented internationally. So not necessarily a gold ideal standard that no country has ever implemented. So that's the first aim. So then you get really a sense of what the implementation gaps are at the country level. And then based on those, the idea is to propose concrete actions. And then the last step is also to have a prioritization of those actions, because usually a long list of actions is proposed. So that's broadly the aims. So industry commitments and practices are not included. There's a separate tool for that. So the Healthy Food Environment Policy Index is really looking at government policies and an evaluation of government action. What's also not included, which doesn't mean it's not important, it's actually very important, but really looking in depth at the barriers and facilitators to policy implementation, that requires different tools and processes as well. And that's not necessarily part of the Food-EPI. The Food-EPI just looks at what the gaps are. So this is just a picture of the framework of the tool. So there's two components, a policy component and then an infrastructure support component. And there's 13 different domains. And across those domains, there's about 47 good practice indicators. So in terms of the policy domains, and because we are looking at the food environment, so these include composition, labeling, marketing, provision in public sector settings, food retail, food prices, and food trade and investment.
Hello,
and then
sorry to prompt you. Can you please expand the slide, put it in slide mode for me?
Sorry?
Can you please put the presentation in slide mode?
I think it is.
Sorry for the interruption. Yeah.
On my screen it is. I don't know what to
Okay,
do.
on your screen it is. Okay, that's fine. Yeah, you can continue. Sorry.
Yeah, it is on the slide mode.
Okay, all right.
Can others also not see it?
Yeah,
It's not as big as
it's not in full screen mode.
It's presenter view.
it's a presenter view, right? Okay, oh, you can continue. Sorry.
Okay.
But it doesn't give us the full screen views. It makes the writing quite small.
You can highlight on it and hide presenter view.
Is it better now?
Yeah.
Yes.
Yeah.
Yeah.
Okay. Oh, sorry.
That's all right.
Okay. Right. So where were we? Yes. So these are the domains, and actually, the tool was really developed based on a review of existing recommendations from high-level policy documents, but then also a consultation with international food policy experts to really get the wording of the good practice indicators right and so on. So there's a whole development process involved as well. So the scope of the tool, because it focuses on food environments, issues like physical activity, alcohol, breastfeeding, but also undernutrition and food production are out of scope. Again, it doesn't mean that these issues are not important. They are very important, but the focus was on the food environment. So that's why these are not included in the first version of the tool. So the evaluation considers the extent of implementation, which means all steps in the policy cycle. And it includes also intentions and plans of the government, also funding that the government has for actions undertaken by non-governmental organizations, and then of course also policies and actions that are either partly or fully implemented. So each of the domains has a set of good practice indicators. So they are really detailed statements. And each of the domains covers several possible actions and policy areas that are covered. For example, food composition looks at setting standards for processed foods. So on nutrients of concern, sodium, sugar, saturated fat, energy, but also standards for out-of-home meals, so provided by food services. Then the food labeling domain covers also several policy areas. So one is back-of-pack labeling and having nutrient declarations on packaged foods, but also regulations for health and nutrition claims, front-of-pack nutrition labeling, and then menu labeling. So each of these domains has different policy areas within those, and then detailed good practice statements. Also the food marketing domain, that's quite a big domain because there's a lot of different settings and media that come under that, like television, but also online and social media, the outdoor environment, children's settings such as schools as well. And then the same for the other ones like food prices. I'm going to go more in detail later on. Food retail provision makes a distinction between children's settings such as schools and early education services, and then the other public settings, which can be hospitals, for example. And then the same is the case for infrastructure support domains, which really covers all important aspects that are needed for the development and implementation of policies. So for example, the governance domain looks at procedures to restrict commercial influences on policy development, the use of evidence in policies, transparency and access to government information, for example. And monitoring is also a very important domain because if we have no data, then it's also harder to have actions happening. And this is going a bit broader than just food environments because you also need, for example, good nutrition surveys to look into nutritional habits of the population and to evaluate the impact of policies, and so on. Funding, and then platforms and health and all policies as well. So I'm going to go a bit more in detail later, but that's broadly what's covered within the existing index. And as you can see, the actual statements are a bit more detailed. So for example, under the composition domain, one of the statements is that food composition standards have been established by the government for the content of the nutrients of concern in certain foods or food groups if they are major contributors to population intake of these nutrients of concern. Similar for the other ones as well. So the idea is always when the tool, when people are interested in applying the tool, that they really assess as well whether all of these detailed statements are relevant for the country context, whether the wording is fine. And so there are some adaptations that are possible as well. Overall, we haven't seen that many adaptations because the tool has now been applied in quite a few countries, but sometimes there are a few adaptations that can be made to make it more context specific. For example, the promotion statements, there are actually 3 different statements that cover broadcast media, non-broadcast media, and children's settings. But in the European context, because there it's a bit more complicated, as the European level jurisdiction also has some responsibilities in addition to the countries. This was divided into 5 different statements to keep also food packages as a separate media, and internet and social media as well. And same for infrastructure support, some examples on the screen. Then, as I said in the introduction, the evaluation is done compared to international best practice or benchmarks. That was a choice in the beginning when the tool was developed. So to evaluate governments against best practices that are already being implemented by other countries, instead of against an ideal standard that no country has implemented yet. And so that means that for some of the good practice indicators, the benchmarks are very aspirational, because we do have examples from countries that are doing really well and have implemented a great policy. But then for a few of the other areas, the benchmarks are perhaps not yet at that ideal level that we as public health people would like to see happening, and hopefully this will happen in the future. But so for each of the indicators, so for the 47 indicators, there are best practices that are selected from countries having introduced and implemented such policies. For some indicators, there's one really best practice. For others, there are actually quite a few. And you can see some examples on the screen, like for marketing, we have the warning labels in Chile that are also used for restricting marketing to children across different types of media. Composition Denmark banned trans fats in food since 2013. So you can just see some examples there. And these benchmarks are updated like once a year, because of course they are moving as countries implement new policies. Yeah. The process of the Food-EPI is also important to highlight, because if you want to conduct this work, it takes about a full year to actually run through the different steps. So later on, I'm also going to go into a bit more detail on these different steps, but broadly speaking, it takes about a year. So you need to start with really looking at the tool, potentially making some adaptations to make it suitable to the country context, getting together a national expert panel who's gonna really conduct the evaluation for the country, liaise with government officials as well, because they are important to verify the evidence document that is being put together, and ideally they also are observers throughout the process, so to make it transparent. The biggest work in the Food-EPI is putting together this evidence document, because for all of the 47 indicators, a comprehensive review is conducted to really detail what actions and policies the government has undertaken over a set period of time for that particular indicator. And because it's not just yes or no that a policy is implemented, all the details are really captured on any working groups that are being established, any plans and intentions of the government. So it's quite often this step is underestimated by countries. It takes up to 4 or 5 months to really do this well, and then to liaise with government officials to get the document to be comprehensive and accurate as well. And then once all the preparations are done, the evidence document as well as the benchmarks are then used in rating workshops where the expert panel is then actually evaluating government in each of the areas. So looking at how well government is doing compared to best practice. And that results in a particular scorecard where you can really see the implementation gaps. And then the next step in the process with the same expert panel is to come up with concrete context-specific actions that can actually address the implementation gaps that have been identified in the previous step. And then this list of actions is then put forward for prioritization as well, because usually countries come up with quite a long list, and so it's good to have some priority recommendations. So I'm going to go a bit more in detail later on, but so it is quite a bit of work to conduct this whole exercise. So what do you actually get out of it at the end? There are several outputs. One key output is the evidence document. Usually it is seen as a key document needed to support the experts to be able to conduct the evaluation. But essentially it's also a key output of the Food-EPI, because you have a detailed document that is laying out all of the efforts that the government has undertaken in the past on these particular action areas. And so essentially, this document can also be used later on for other purposes, for advocacy efforts and so on. So we have really seen that this document is really valued as well as one of the key outputs, and not just as an instrument during the process. So it's also important to highlight it in the end, that this is really part of the results and a key output. So the next thing you get is, of course, the scorecard, which is broadly speaking, highlighting areas where government is doing well, but also not so well compared to best practice. So this is just an example, I think, from Australia, but it looks similar for other countries that have conducted the exercise. Then the next output is your policy and action priorities. So, and these are country specific because it depends on what are the implementation gaps in the particular country, and it's resulting from this discussion among experts, what actions should be put forward. And usually the prioritization is done looking at both importance as well as achievability. And so countries, they do make certain graphs to then highlight these aspects. And then they come up with a set of 4 or 5 priority actions, in this case for the policies. So sugary drinks taxes, improving a labeling system that is already in place in this case. This is also just an example from one country. The actions can be quite specific from one country to another. For infrastructure support, which is the other component of the Food-EPI, the prioritization is done separately because it's hard to compare an infrastructure support action with a policy action. So usually the components are dealt with separately. But here again, so you look at importance and achievability and you select your key priority actions. And then ultimately, you will come up with a set of, let's say, 7, 8 actions, but you can still put them really nicely together into a policy package for the government. Because of course, some of these infrastructure support actions, if they are about organizing a nutrition survey or having a new plan, a nutrition and health plan, they can be more overarching and they can capture then the specific priority policy actions under that. So several countries are then really putting it together into a policy package once they have their key priorities. And then, of course, the dissemination. I mean, there's quite a few examples that we can share. Once we have a Dropbox, we can share with all the examples of reports and infographics that have been prepared by several countries to then disseminate the results. It's also good to conduct an evaluation with the experts that have been involved, because actually it can be, I mean, experts do engage them for a whole day and to participate in this process. It's also nice to see if do they get something out of it. And usually we see that they do feel they get a bit more knowledge on food environments and policies, and also everything that has been implemented or is on the agenda in their own country. They learn a bit about the best practices worldwide. And then most of them generally think that indeed the project is likely to contribute to policy change, and they feel it's important to regularly repeat this process to see if progress is happening. So you can always do this kind of evaluation with experts to see what have they gotten out of it, or how do they think the process can also be improved in the future. Usually a small evaluation is also done with government experts that were included. This is also just one example from a country. There's generally some positive aspects, but also some comments on the fact that, okay, the process can be burdensome in a way to collect all of this evidence. And then also the comment that there's quite some interest once the report comes out, but then obviously, as we know, the interest can quickly subside as well after the media attention has gone. And that's why it's also important to see this as a monitoring exercise that ideally can be repeated in the future once it has been conducted once, that every so many years you could repeat it. So that was a brief introduction on the Food-EPI in general. So now when we look at it internationally, so it looks like someone is writing on my screen. Do you see that as well with the red line? I hope not. But
yes,
okay.
I see that.
Okay. I don't know where that's coming from, but anyway, it's fine.
So please check your cases so that they don't actually disrupt the screen, please. If you can please check your cases. Thank you.
Okay, so the red lines are not mine, but okay. Well, so there are a few countries that have implemented Food-EPI so far, or that are in the process. So in Asia, we have 4 countries that are finished, and then China, Japan, and Sri Lanka are currently in the process. In Africa as well, we have 4 countries that have now implemented the Food-EPI in slightly different ways, perhaps. But so Ghana, Kenya, South Africa was the first one, and then Senegal has recently completed as well. And then as part of some new projects, Tanzania and Uganda, as well as some other West African countries, are also aiming to implement Food-EPI in the coming 2 years. Also Latin America, Canada, And then New Zealand, Australia, Fiji have implemented Food-EPI. And in Europe, a big exercise is underway as well. Europe is interesting, as I said before, because there we have an additional complexity where we have the European level jurisdiction as well, which has responsibility for quite a few of these policy areas. And so making the distinction where the jurisdiction of each country sits compared to what the responsibilities of the European jurisdiction are, add a bit of complexity to this kind of exercise. But it's nice that so many countries are doing it in Europe at the same time, which will allow some clear benchmarking for this region of the world. So some multi-country study has also been conducted with countries that have already implemented Food-EPI in the past. So this isn't necessarily up to date. It includes 11 countries that were the first ones to do the Food-EPI. It is a bit challenging as well to benchmark countries in different regions of the world because the expert panels, for example, can be quite diverse, as some countries have a stronger NGO participation than other countries. Other countries may have more academics or that participate in the process. But nevertheless, it's good to look at the gaps in broad ways and see where countries sit. So broadly speaking, you can compare the implementation gaps across countries and look at the percentage of policies that are really evaluated at very little, if any, low, medium, or high implementation across countries. So there is some diversity. What you can also see is that because we have 47 indicators, there's actually no country that has a high percentage of best practice policies. For example, Chile is doing really well, but then these policies capture 3 different policy areas. They can still do a lot more in other areas as well. But there is enough variation across countries to really do some benchmarking, while no country is really at the level of best practice in all of these areas, which we would ideally want. For actions, of course, this is very country specific, but we do see that the priority actions that have so far been proposed, the top 5 policy areas, potentially no surprises there, of course, we kind of expected, but the number 1 area where actions are proposed is increasing taxes on unhealthy foods. Then secondly, front of pack labeling. And these are the 2 areas where you can also see that internationally, there is actually a little bit of snowballing going on with more countries taking action. The third one is also often highlighted as a priority. It's an extremely important policy area, restricting junk food marketing to children. But there internationally, there's not that much progress on countries taking comprehensive and bold actions, although there is a few. And because the priorities are based on an assessment of both importance as well as achievability, we can also see that not all of the priorities that countries usually put forward are for areas where the country is really not doing anything yet. It can also be for some areas where there's medium level of implementation. So usually the list of priorities, it's a mix between really new actions that are being proposed because the country has no action taken in this area. So there's a real implementation gap. But usually there's some actions as well where experts feel that, okay, we have something happening, but we want to improve it, which is also more achievable in a way because there's already something there. So if you have a front of pack label, perhaps you want to make it mandatory to have a stricter algorithm and so on. So there's already something happening, and the action or the priority action that is put forward really wants to stimulate government to make it better. So usually it's a combination. As I said, it's a monitoring tool. Most countries that have conducted a Food-EPI so far have only done it once. So we really hope in the future that there will be more countries who repeat it. An example is New Zealand, which has, since 2014, has done 3 times the Food-EPI and is able to compare progress. Although in this case, not much progress has happened. There was improvement for only 1 indicator. So it's also not necessarily that the Food-EPI, there's a lot of different factors that play, of course, whether or not policy action is happening. But nevertheless, it's important to monitor progress and to see, okay, where do governments improve? Do they actually act on the priorities that are put forward? Or is there even a reduction in action, which can also so happen, which was the case for New Zealand for a few indicators as well. So the European exercise I already highlighted, so that's another use of the Food-EPI. It's really the supranational level. So there's a European-wide expert group that is also doing an evaluation of the European level jurisdiction to see where Europe can also improve its policies, where it has jurisdiction, of course, because for some of the policy areas, the jurisdiction sits with the countries themselves. And this is also challenging because it's the first time that this is being done. For example, for the labeling domain, we see that there, for the 4 indicators that we have, 2 of the indicators really sit at the European level or really predominantly sit at European level. The front of pack labeling is an indicator where there is shared jurisdiction between the countries and the European level. And then the menu labeling, that's more national or even local level. So you can see that, okay, these jurisdictions can also be important, even in some countries like Canada and Australia, where there's a lot of jurisdiction also at the regional level. So that's something to consider as well. If you conduct it in your country, you look at these different policy areas and you think, okay, where does the jurisdiction to act actually sit? Is it with national government only, or is it also with some of the regional governments and so on? So yeah, as I said, so some countries have implemented the tool at the regional or provincial level, which is really nice as well, because then you can compare action across provinces and regions. What we do see, however, if you go to the local level, in this case, the provinces in Canada, not all of the indicators are relevant or applicable. So it's only a subset. And then if you look at the city level, for example, about half of the policy indicators are still relevant. Of course, this can also vary a bit from city to city. We haven't really explored that aspect very well. I think some cities have more jurisdiction than others, but Canada applied it, for example, and we see that about half of the indicators are still relevant at that level. All right, so that was like a very broad overview of the tool, the process, the uptake. So I hope that was clear. So what I want to do now is to go through the tool itself and the indicators and what good practice indicators are actually covered by the tool, so that you have a better sense of what's included. So this is again the overall framework. As I said before as well, we do have a very detailed list of good practice indicators, which are detailed written statements, and I'm not going to just go through them all in detail because that wouldn't be so sensible to do in such a meeting of today. But I did want to go through the domains and the action areas or the indicators that are covered. But as they are printed on the screen, it's a summary. It's a short version of what the actual indicators are like. And so they are available, so you can look at them into detail when you are interested to apply the tool. And it's also important that you go through the very details of the wording of those indicators to see if it's applicable for your country or if it's relevant or if anything has to be changed. So one of the policy domains is the food composition domain, which really looking at whether there are government systems implemented to ensure that where practical, processed foods minimize the energy density and the nutrients of concern. And here the indicators cover really two aspects. One is looking at such standards for processed foods, while the other one is looking at standards for out-of-home meals and food service outlets. So the next domain is food labeling, which is quite a broad domain as well. So that's looking at whether there are regulatory systems implemented by the government for consumer-oriented labeling on food packaging and menu boards in restaurants to enable consumers to easily make informed food choices and to prevent misleading claims. So the first indicator is a very obvious one, and also in many countries low-hanging fruit because it's already there, but it's still important. So it means for the back of pack labeling that we have nutrient declarations on all packaged foods, which this is not yet the case in countries in Africa, for example, but in Europe this is pretty standard. But even there, you can have some aspirational actions as well that not all countries have, like for example, including added sugar on the label, which is now the case in the US, but not many countries have that. Or labeling of trans fats is also something that not many countries have. Most countries that have this in place have it for the 7 common macronutrients and sodium that we know. So in any case, it's important to have it. But then the next one is really looking at having regulations on nutrition and health claims. And what's important there is as well to have a good nutrient profiling system, for example, to prevent nutrition and health claims to appear on less healthy foods. And while there are quite a few countries having such regulations in place, not many of them have a good nutrient profiling system. Australia and New Zealand are known to have this, but very recently, we even have a better example from Mexico, because Mexico recently also introduced the warning labels. As we know in Latin America, they go for warning labels on foods. But what's good about the Mexican example is that foods or packaged foods that really have one of these warning labels, whether it be for salt, saturated fat, sugar, they cannot have nutrition and health claims anymore. And that's, I think, a world first that we have. And it's been calculated that this would mean it would reduce the current nutrition and health claims that they have on foods with about 50%. So that's an example of this. Then the third indicator is then looking at front of pack labeling, for which there are internationally quite a few different systems, like the warning labels or the health stars, Nutri-Score, which are more summary labels. And usually this indicator is looking at even the benchmarks. They do cover several systems because there's not yet enough evidence to say which front of pack label system is really the best one. But okay, so this is the third indicator. And then the fourth one is menu labeling, which can be for just calories, but there are a few examples for nutrients as well. So that's the food labeling domain and what's covered there. So a very important domain is food marketing, especially since this is an area where internationally there's really a lot more actions needed. There's only a few isolated good examples here and there, or countries that do have some regulations. They have it on for example, marketing on TV, but just having a few hours of the day covered, or it's not really comprehensive. So it's a really important domain that needs more action to protect children really in a comprehensive way from exposure to junk food advertising. So as I've already said before, this is usually divided into 3 different indicators: the broadcast media, which covers TV, radio, for example, then non-broadcast, which covers quite a few different media, from outdoor to social media to packages, for example. And then the last one is settings where children gather, which can be schools, but also sport clubs and so on. Yeah. Some countries have gone to 5 indicators in this case because they felt it's important to distinguish internet and social media and food packages separately because the jurisdiction sits in different places. So you can do that. You can actually, although it's also not recommended, as we already have 47 indicators, the idea is not to come up with 100 because then the exercise would become infeasible. But there is a way to further split indicators and then to bring them together in the end if we want to compare different countries, for example. So you can actually do that if it's for the context, you feel it's really important to do that. In Ghana and Kenya, it was decided to also add an indicator on restrictions on marketing of breast milk substitutes. That's, of course, an extremely important area as well, but because the original tool focused on obesity and NCD reduction through improving food environments, this was actually seen initially as excluded. But of course, countries can decide to add indicators where they feel it's important. So pricing policies or fiscal policies are also becoming a bit more common internationally, especially sugary drinks, taxes. So this domain has 4 indicators. One is really looking at minimizing taxes or levies on healthy foods. For example, Australia has a policy there leaving GST of basic foods, including fresh fruit and vegetables. The second one is then really looking at taxes on unhealthy foods or nutrients of concern. The third indicator is looking at the intent of existing subsidies for foods in countries and whether they are for healthy rather than unhealthy foods. So it's looking at if there are subsidies, do they favor healthy rather than unhealthy foods? So it's not necessarily looking at how many subsidies are there, or for example, some countries may also decide to exclude this indicator if it's not applicable. And then the last one is looking at whether food-related income support programs do favor healthy foods. The provision domain is a very important one as well, because that largely focuses on children's settings as well, like schools, early childhood education services, and looking at whether there's food standards in place or any other policies on these grounds to encourage the provision of healthy foods. But there's also the second indicator then looks at other public sector settings and similar policies like removal of vending machines, food standards, and so on. And then the second and third indicator is more looking at whether there's support, training systems, or guidelines that the government is developing to help these public sector places or settings to develop and implement such policies. So food retail is important as well. It covers 2 aspects. So the community food environment, which is really how outlets are distributed. So the place, the location, the density, the proximity, but then also in-store. There's several areas that are important as well, looking at the prominence and availability and promotion of healthy versus less healthy foods. And there are 4 indicators here because there's a distinction made between stores and services. like fast food, for example. So the first indicator is then really looking at whether there's any zoning laws to place limits on the density or proximity of outlets selling mainly unhealthy foods, while the second one is then specifically looking at zoning laws to encourage availability of outlets selling fruits and vegetables. And then 3 and 4 really look at in-store or inside services to look at stimulating the availability of healthy foods and limiting availability of unhealthy foods. And that's also an area, of course, where internationally there's not that much action happening, because it's rather more difficult to introduce a policy like this compared to some of the other ones that we've just seen before. Trade and investment, that's a domain where it's good to have some experts with knowledge included, where you can consult with them, because it's quite a difficult domain also to gather the evidence for it, to do the evaluation for it. So it's good to bring in people with particular expertise. It's also not necessarily my expertise, this domain. Some people in government also have particular expertise on this domain. It broadly covers 2 indicators. It looks at whether impacts of trade and investment agreements, so it can be existing or under negotiation, whether impacts on nutrition are included. That doesn't happen. We don't have really good examples of this. It's usually food safety or impacts on the environment that are included, but population nutrition is something that is not or held more broadly is to have real health impact assessments of that done by the government is not something that is really commonly done. Then the second one is whether specific measures are included in those agreements to manage investment and protect the capacity of the government to be able to put in regulations for public health nutrition. So these are the policy domains. Then we have, of course, the infrastructure support. So all of these 6 infrastructure support domains are very important as well, to really make sure that there is development and implementation of these food environment policies. I'm probably going to go through those a bit more quickly to be able to have time enough to cover the process as well. So leadership, it's a domain that is looking at several aspects of leadership. Firstly, seeing, is there really visible political support for improving food environments in the country? But then the other ones really look at, has the government set any targets to reduce nutrients of concern over a specific period of time? Has the government developed and implemented evidence-informed food-based dietary guidelines? Is there a comprehensive nutrition and health plan or strategy, including actions to improve food environments? And then the last one, because that's also really important, are there any priorities to reduce inequalities in regards to population diets and nutrition? The governance domain is also important. So it's looking at procedures that exist implemented by the government. So one is looking at procedures to restrict commercial influences on the development of policies. This is really an area where there's, luckily, in the last few years, there's a bit more attention and research on this happening, but we probably need a lot more. The second indicator is looking at policies and procedures for using evidence in the development of food and nutrition policies. The third one is looking at the issue of transparency in development of food and nutrition policies. And then the last one is evaluating government, whether there's sufficient access to nutrition information for the public. Monitoring, as we all know as researchers, is also a very important domain, really having the data available to be able to prioritize certain policies, evaluate certain policies. And the first indicator is kind of obvious because the domain or the index is dealing with food environments, which means ideally we want the government to conduct regular monitoring of food environments, which means foods provided in schools, marketing to children, having good branded food composition data. So it is quite a broad issue, and we do know that there's really not many governments that do this. Usually it's the researchers that apply for funding elsewhere to be able to conduct some of this work. But this indicator is really looking whether government is in any way providing funding or prioritizing monitoring for some of these very important domains. But then also looking at monitoring of nutrition. So what are people eating? Some countries only conduct a nutrition survey every 15 years, for example, and there's no good other data available. So having good nutrition data is, of course, also important. And then monitoring of overweight and obesity, NCDs and their risk factors. Whether government is also providing funding to evaluate policies that are implemented, that's also important. We know that quite a few policies are usually not well evaluated, or again, it's the researchers that try to apply for funding to evaluate certain policies, but ideally there's a role for government there to really make sure that there is good evaluation of policies that they do implement. And then here the inequalities as well. So monitoring progress towards reducing diet-related inequalities. Funding and resources, that's a complex domain, especially when you look for evidence, because it often requires putting in an official information requests to the government to get those figures, as they are often as such not publicly available. So, but nevertheless, one of the indicators is looking whether the budget spent on population nutrition promotion is sufficient to reduce diet-related NCDs. So here you often put the budget against the burden of diet-related NCDs in the country. There's a definition of what we mean with population nutrition promotion, but sometimes it's hard to fully get the figures according to that particular definition, and but then countries are specifying what definition they did use or was possible to get the information for. The second one is looking at government-funded researches targeted for improving food environments. And then the last one is whether there's a statutory health promotion agency in place. The next domain is looking at platforms for interaction, which is of course important as well. The first indicator is looking at platforms across government departments, but also across levels of government, like regional, federal, for example. The second one is looking at platforms between government and the food industry. But obviously, this is more looking at implementation, because previously we had the governance domain where we had an indicator looking to limit the influence of the commercial food sector on the development of policies. But for implementation, having platforms available is an indicator that is included. Then platforms between government and civil society. And then the last indicator is potentially a hard one, because there's only a few places in the world that really have such an approach, but it's looking whether government is implementing a systems-based approach to improve the healthiness of food environments. And then the last domain here of the Food-EPI and of the infrastructure support, which is also important, is health in all policies. And this is divided into two different indicators. So one is whether nutrition and health outcomes in the development of food-related policies are considered, while the second indicator is more broadly looking at health impact assessments for non-food policies. Some countries have actually combined these two indicators in the past because the evidence wasn't necessarily so different for both. So that's also an option to make actually the exercise for the experts a bit more feasible. Like if the evidence is the same, or you can actually do that as well. I mean, we have conducted also an evaluation of the tool with the countries that have implemented it to really extract what are now the main strengths, but also the limitations of the tool. So not the process, so the tool. So generally people feel it's comprehensive for what food environments is considered. And indeed, we have seen not many extra indicators have been introduced over the years. When we look at the overall Food-EPI, the reliability of the tool is good. We do calculate inter-rater reliability, and generally that's fairly good in different countries. It is flexible for adaptation to the country context while still trying to maintain comparability with other countries. Also, the fact that the indicators are derived from existing high-level recommendations at the international level is also seen as a strength. And then the fact that evidence is collected for each of those indicators to really support the experts that do the evaluation is also considered as a strength, as it makes the tool more evidence-based. But there are also some limitations because we do know that the tool is quite long with 47 indicators, which does make the evaluation a bit time-consuming. But then even though the tool is long, some experts also feel that for some indicators, when they have to do the evaluation and the indicator covers several different aspects within it, like looking at different nutrients of concern in one indicator or different settings within one indicator, it can be difficult to do the evaluation as well. And hence, there is the option to, if it's really for the context important, it's possible to split indicators if that would make it easier and if it's for the context really important. And then while the overall tool is reliable for some selected indicators, the agreement among experts and the evaluation is not always as good as for others. And that can happen when the best practices internationally are, for example, not really close to the ideal, or whether they do not cover all aspects of the indicator. Yeah, the other things I will come to when I discuss the process, I think. All right, so how are we going? Yeah, I still have time. So this was an overview of the tool. You can have a look at any time in more depth at all of the indicators and how they fit together and what the detailed wording is and so on. But then, of course, we know the process is very important. So how it's actually conducted and the different steps. How long do you need to foresee what resources are needed to conduct the exercise? I already explained previously broadly the different steps, but I was going to go in a bit more detail now. So when you're interested to really do this in your country, it's really good to assess the political context. Some countries really try to follow the election cycles and to have the evaluation done at the end of government term to then launch it before the elections, but that's not always possible because it depends also when you get funding to do the exercise. So it's not really a must, but it's still good to know, okay, what is the political context right now and when would be a good time to conduct the exercise. And you also need to determine your time period for evaluation. Is it going to be the last 3 years of the government being in place or another time period? So there's several aspects to consider before you get started. Then I already talked about the adaptation of the tool, which is of course possible. So the tool is not to take as it is. Well, ideally we want to keep the international comparability, but it's very important to look at all the indicators, check relevance, also see are there any indicators that are missing that you'd like to add? Do you potentially want to aggregate some of them because the evidence is very similar, or there's no evidence at all for this domain? Or do you want to also disaggregate some indicators because maybe your country has a lot of policies on sodium and nothing on all of the other nutrients of concern, for example? Usually there's also a translation and back translation just to make sure that the meaning of the indicator in the original language is still the same as it was originally meant with the Food-EPI. Yeah, because often if translation is done by people that don't know the tool very well, so we cannot always check all of these languages because it's, yeah, I mean, Japanese, or it's not possible to do that. Then a mapping of stakeholders is always good. You need to look at what's the expert panel going to be like, who are the organizations that you want to have as part of your experts panel, well, organizations and academics and so on, and who are the key stakeholders in government that you will need to contact or engage with for the evidence document, and ideally you would like to have them observing the process as well. And then setting out the time frame, like when do you want to get started and have the different steps done, but also when are you aiming to actually launch the results? Because it's good to pick a good timing for it. You can do it in conjunction with an important event, or if you can launch it before the elections or so on. I mean, that's up to every country, but it's good to think about it. So the expert panel is really, because I always get the question, what's the size of the expert panel? How many people do we need? And actually there's no real answer to that. The idea is to have a panel that is really representative of the public health nutrition community, which covers the organizations, NGOs, and academic experts working in this area. And so really the size of the expert panel can vary from country to country, as you will have seen on one of the previous slides that was looking into comparing different countries. I mean, countries like Canada, Australia may have up to 100 experts, where other countries may only have 30, for example. Of course, it also depends on the response rate, which can also vary quite a lot from country to country. But broadly speaking, you want to have a panel representative of the main organizations and universities, academia in your country. So you do want to make a comprehensive list and check it with some other key experts that you haven't forgotten anyone important. Yeah, experts with conflicts of interest are usually excluded. They do need to fill that out before partaking in the evaluation. Sometimes, yeah, it's sometimes hard as well to decide what's exactly a conflict of interest or what isn't, but obviously, I mean, people with strong ties to the food industry would not be included, but then you evaluate the government, and generally, because many experts are sitting on government advisory committees and so on, yeah, this is not considered a conflict of interest. The rating is also done anonymously, because otherwise we would have no experts that can participate yeah. But there is a form for that and some criteria, and it can be discussed as well at the country level to see which experts you really want to have excluded from this evaluation. And so government officials are generally not part of the expert panel, so they are involved in verifying the evidence and also as observers, but we know that a few countries have taken it a step further, but that also requires extra resources if you want to do that. So they have actually conducted a self-evaluation, which means that governments also conducted the evaluation. Well, government experts also conducted the evaluation themselves, came up with actions themselves and prioritized it. And then it's of course interesting to see the evaluation of the independent expert panel compared to how government is evaluating themselves. But that is not a necessary, or that's not part of the original protocol. So the most important part of the whole exercise is really the evidence document. And it's really important to highlight that it shouldn't be underestimated, because it's very often underestimated when countries want to conduct a Food-EPI and want to get started. Because as I said before, it's more than just having a checklist and looking at which policy is implemented or not in the country. Of course, you can actually have some domains or some indicators where there's really nothing at all happening. And so in that way, it's easy to collect the evidence because there is none. But it is usually quite a big job to pull this document together and to look into detail at what's already available, firstly, publicly, but then engage with government officials to check, do you have everything? Is it comprehensive and accurate? Does anything need to be added? So the burden is not only in terms of the personnel that needs to put this together, but you also need to allow for sufficient time to engage with the actors, especially the ones that are outside of the Ministry of Health, because the Ministry of Health usually has more of a connection with this index and the food environment and so on. But then you have other ministries that also need to check, like Ministry of Education, Social Affairs, Trade, for example, for whom this exercise is a bit more removed from what they do on a day-to-day basis. And so you need to allow sufficient time for them to look into it, to get back to you and so on. So it's in terms of time as well as the investment to actually put this together. This is the step that is the most resource intensive and time intensive as well. We do have a protocol which is highlighting some of the sources that you can look at in your country, but it can also vary from country to country. Some countries have a lot more a lot more of these policy documents that are publicly available than others. The types of evidence to include, so commitments, intentions, plans of the government, establishments of official committees, expert panels, working groups, platforms, also particular studies, reviews, or consultation processes that have been undertaken, policy briefs, proposals, monitoring data, and also any funding that government has provided across these different areas. Yeah. So
Stefanie, just to alert that you have 45 minutes remaining. So if we can use 30 minutes for questions and answers.
Yeah. So that will
So
be fine. So I have about 15 more minutes.
That's correct. Yes.
Yeah, thank you.
That's okay.
So we do have a scope document for the evidence as well, and that can be very useful for the researchers who are going to lead the Food-EPI, but also for the government experts who verify the evidence. Because for each indicator, and especially if you're not so familiar with the Food-EPI yet, it can be a bit confusing about what's now included here and what goes under the other indicator or what's excluded. And I'm not going to go into the details of this, but just saying that this is available to highlight several, like for example, this first one on food composition. This is, for example, not including micronutrients, for example, or a composition of ready-to-eat meals in food service outlets, because that's part of another indicator. Also, the provision of resources or expertise to support companies with reformulation, as that is also part of another indicator. So it's just good to have this document. So we have this for all of the indicators. Some definitions as well, like what's a nutrition and health claim and so on. Then, okay, as I said already, this document has to be verified with people in government, not just the Ministry of Health, but really people in different departments. And that's why this mapping is really good at the beginning. Also the mapping of government experts that you want to involve. Okay, I'm going to skip this. This is from Ghana, but it's broadly what I explained, how they did the evidence collection. They also did the mapping for each indicator. What are the key evidence documents that they use to extract the information? So that's, and you can see a few of these documents are, of course, are included for different indicators, like the NCD strategy, national NCD policy, which covers quite a few of these different areas. And you can also see that for some indicators, no policies were identified, which means there's no action happening for this particular indicator in Ghana. And then the same for the infrastructure support domains. These best practice exemplars, that's something that is put together usually by INFORMAS itself and is provided to countries who want to conduct the Food-EPI. On certain occasions, this can also be changed a little bit. Like in Europe, again, that example, some of the best practice exemplars are not applicable because it wouldn't be possible, for example, at this point in time for European countries to introduce mandatory front of pack warning labels. And so in that sense, for the European exercise, it was important to only include those benchmarks that are possible to implement in this context. But broadly speaking, for the other countries internationally, they have usually used the benchmarks that have been put together. I'm perhaps also not going to go into the very details of this, but the sources, so INFORMAS is putting this together from existing databases, from input from policy experts, but also existing Food-EPI evidence documents from countries that have already conducted Food-EPI, because these are very detailed policy documents. And so sometimes you can come across new best practices from a country that is currently conducting the Food-EPI, for example. So they are selected based on strength and comprehensiveness. They are not always just one, but there are a few, especially like for marketing, where some countries are, for example, doing well, they cover more media, but some countries cover less media, but they have a better nutrient profiling system, or some countries cover children up to 18 years, but then have less media. So it's not always possible to just select the best practice. It's usually a selection of examples. Yep. The rating process is usually done in a workshop format, but it can also be done online. Some countries have organized it online, but I think in the context of Africa and low and middle income countries, especially where the concept of food environments is still something very new and it needs explaining, and the experts really need to familiarize themselves with it. I think it's recommended to do this really in a face-to-face workshop if possible. So experts are presented, so they get the evidence document on beforehand, but then on the day, the evidence is presented for each indicator, the benchmarks are presented, and then they get some time to put in their rating for government action. We are using a Likert scale for this, broad categories, because obviously experts have to weigh several things in their minds about what's the quality of the policy, the extent of implementation, and so on. So it's not an exact mathematical exercise. And so we do use 5 categories for that, for experts to put in their rating. And we can assess inter-rater reliability or agreement among experts on the evaluation afterwards as well. It's important to also highlight to experts when this exercise is done that it's important as well to give credit where credit is due in comparison to the benchmark, because sometimes we know that public health experts can also be quite harsh on the government because they always want to have, and that's good, we do want to have better policies and we want to move them towards the ideal best practice. But if government is taking certain actions and if we compare that to what's happening internationally, it's important to do a fair evaluation for that. So it's, yeah. Usually the workshop can be, the evaluation itself can be done in half a day, but we know from some of the African countries like Senegal, they have taken a lot longer to do it. They have taken a full day to do the evaluation because there was some discussion or they wanted to allow enough time. So it's a little bit up, yeah, that needs to be discussed, like how much time do you want to take? It can be done in half a day, but it's also good if you can take a bit more time. The next step is then identification of actions, which is always in a workshop format. This is not online or not experts individually. What we ideally want is some good discussion and some kind of consensus of what are the key actions that the expert panel is wanting to put forward for implementation by the government. And they do use the implementation gaps for that. So the results of how they rated are presented back to them so that they can see, okay, labeling, composition, marketing, where are the main implementation gaps and so on. It's not necessary to propose an action for each indicator. It's up to the experts to decide, okay, these are the actions that we want to put forward. And there can be some discussion sometimes that not all experts agree or so on. And sometimes a voting process is included, or actions that are supported by the majority of experts can be put on the list because there is still a prioritization exercise. But the idea of this is really for this to be also a workshop where people go through the results and discuss together on the actions that can be taken. The prioritization, on the other hand, which happens afterwards, is an individual exercise. So once we do have the final list of proposed actions for both the policies and the infrastructure support, experts are individually prioritizing the actions according to importance and achievability. And there's a set of criteria that can be used for that, and that is explained to them. And then the results are actually put together, and then actions that get the most points are the most important or achievable. You can also rank them, or you can allocate points to them. There's several ways of conducting the prioritization, but it's the way it has been done up to now. It's an individual exercise. I can see ways it could also work in a group, but okay, that's to be discussed. It's always been done individually. And then we have the analysis. That's probably something I can go through quite quickly. What you get is your scorecard, your inter-rater reliability. We do have tools and support to do all of that. For countries that need help, you can produce graphs to show your actions and priorities. Something that is also quite nice to do is once you have your final list of priority actions, you do a mapping of government agencies and actors that are really needed to implement those priority actions. Because it's really not just the Ministry of Health. There are a lot of government entities at the table that are needed to really implement these priorities. So some countries have done that and included that as part of the final report as well. I already shown that, but it's part of the analysis as well, an expert evaluation. The dissemination countries do that in different ways. We have all sorts of examples of the reports, infographics, leaflets, and many of those are also in English or maybe in French as well that we can share. There are, of course, quite a few that are not in Spanish, that are in many different languages, but we do have a good amount of examples there.
Stefanie, just about 2 minutes, please.
Yeah.
Thank you.
Okay, so that was a bit on the process, and very briefly, I'm not going to go into the details, but what we are planning is to adapt this index to better capture or to better evaluate action by governments to tackle the double burden of malnutrition, because we have focused on the food environments to reduce obesity and NCDs. And as part of some projects that are happening, we are aiming to look into developing indicators to evaluate actions on the double burden. And again, we have compiled existing recommendations, and we are now thinking about how can we really integrate these aspects without creating a completely new tool. We want to keep comparability with the existing food EPI. We don't want the tool to become way too long. Maybe we want to really keep the focus on the food environment, which means that some undernutrition actions might not be covered. That is something to discuss, of course. Maybe we can also have some discussion on that. But the key point is that we really want to prioritize double duty actions that governments can take. So to really have more impact on reducing the double burden of malnutrition. And some indicators in the Food-EPI actually are already double duty, while some others are really more specific to obesity and NCDs. So this is going to be done also in Africa with some countries that are going to try to integrate this. So that's the end. The future developments, we want to really increase uptake. We want to stimulate more countries to do repeated assessments. And maybe we also want to think about an index on sustainable food systems, which is a whole other piece, because in that way, we would really create a new index. You can't just have a few indicators covering that. That would be, but it's also interesting to develop something like that and maybe pilot it in a few countries. And have a think about applying the Food-EPI at the local level a bit more, like Canada has done. But then it would be interesting to include sustainability, as cities are really at the forefront of sustainable food policies, and merging that with the food environments would be quite interesting. So that's really it, I think, for now. So I hope it was useful as a broad overview so that you have some idea if you wanted to do that in your country. And as I said, the materials and support is available. And also very happy to hear of any further improvements or ideas that you may have to take this work forward, whether it's improving the tool or increasing capacity or creating linkages with other work that is ongoing by others. So yeah, thank you very much.